I went up into the emergency room at first, and they said that I need to go see Dr. Toppy. She told me that it was metastasized breast cancer, which means it's spread through my body, and it was not very good. That's when I found out it was stage 4 breast cancer. I had lost use of my leg, I lost use of my arm. I basically was stuck in a wheelchair.
So many people are diagnosed with cancer and surviving now. We found there was a definite need to address some of the limitations that they face after cancer and after cancer treatment.
I couldn't reach up into the cabinets to grab stuff, everything was difficult for me. I couldn't even pull out the gallon of milk to pour in my coffee for coffee in the morning. And it was just very uncomfortable. I did not like not having control of normal basic things that you do for yourself every day.
Raw's better.
A lot of times after radiation treatment, the patient will experience a tightening of the skin and tissue, and sometimes that lingers for several years. So we've had great results with people 3, 4, and 5 years out of cancer treatment to restore their range of motion and their mobility in their arms.
Within, I guess, a few months' time, they pretty much got me functioning on my own, where I was able to walk and stand up straight, because I was pretty much hunched over for a while. I didn't know anything about the physical therapy when I first came in here. And when I came in, they were just terrific. Very welcoming, made me very comfortable. They said, they didn't look at me and say, oh man, this girl's got stage 4 cancer, what are we going to do for her? They went out of their way to find things to do for me, to help me, to get me back to being mobile.
Our cancer rehab program is a multidisciplinary approach involving physical therapy, occupational therapy, and speech therapy to address some of the deficits cancer patients have before, during, or after any cancer treatment, whether it's a side effect of the cancer itself or a side effect of the medical intervention or the radiation.
You control your own life, and if you want to move forward and fight things, you have to be headstrong, and you have to be willing to commit, and it was just, it's terrific. I'm so glad that I did what I did. I'm so glad that I talked to Dr. Sai about coming into the rehab for physical therapy, because I don't think I would be this good now if it weren't for physical therapy.